Good afternoon, distinguished colleagues and members. My name is Dr. Racheal Alinaitwe. I'm a psychiatrist and the Secretary General of the Uganda Association of Psychiatrists. It's my honor to welcome you to today's important CMA, which is going to be on regulation and setting standards for psychiatry practice in Uganda. The role of three partners, that's the Ministry of Health, the Uganda Medical and Dental Practitioners Council, and the Uganda Association of Psychiatrists, or UAP. I think our panelists are not yet here, but allow me have a few introductory remarks as we wait for them. I'll introduce them once they log in. So I'll begin by congratulating our freshest psychiatrists from Makerere University, who are an addition to our workforce. And I'll also remind us that our CMEs are held every last Friday of the month. So we'll have another on the 27th of March. As we dive into this topic, why this particular topic? It's because the mental health landscape in this country is evolving very rapidly. We are seeing increasing demand for the services. From the recent population report, we note that 1 in 4 Ugandans have some kind of mental health challenge. But we are also seeing new models of care and a growing workforce. So with this growth comes a responsibility for us to ensure that psychiatry practice remains safe, ethical, and aligned with not only the National Mental Health Act, but with the international standards as well. But also today's CME is important because the Ministry of Health is operationalizing guidelines on licensing and supervising private mental health units, rehabilitation centers, with a particular focus on patient protection. And yet, we also know that regulation will not merely be about compliance. We are protecting the public, we are strengthening the professional identity, and ensuring that every Ugandan actually receives high-quality mental health care. So in today's conversation, we want to bring together 3 pillars in this regulatory ecosystem. The Ministry of Health that sets the national policy and strategic direction, the Uganda Medical and Dental Practitioners Council that oversees the licensing, discipline, and professional standards, and then the Uganda Association of Psychiatrists, which represents the practitioners, but also the advances in the profession. So today we want to explore how these institutions can work effectively to shape the future of psychiatric practice in Uganda. Let me see if our panelists have joined in as we work towards shaping psychiatry practice. Yes. So without any further ado, allow me to introduce the panelists present. I'll begin by introducing Dr. Hafsa Lukwata, who is from the ministry, who is the Assistant Commissioner for Mental Health at the Ministry of Health. She provides national leadership in mental health policies, service organization, and strategic planning. Her work, as you'd imagine, focuses on strengthening mental health systems, improving access to quality care, and ensuring that mental health remains a priority within Uganda's broader health agenda. Dr. Hafsa Lukwata, you're very welcome. We are ready to hear your remarks. I'll be keeping time on your behalf. So I'll give you 15 minutes, Dr. Hafsa. I'll remind you when you have 5 minutes left.
Okay, thank you very much. Yes, thank you very much, the organizers of this webinar. My name is Dr. Hafsa Lukwata. And yeah, you can even add the Sentongo if Lukwata is becoming a problem. So I'm Hafsa Lukwata Sentongo. And truly, I'm the Assistant Commissioner, Mental Health and Control of Substance Abuse. And I'm very happy to be here. I would like to thank Dr. Lillian for the invitation. She's been reminding me every other day. And I have the pleasure to present to you the role of the Ministry of Health in regulating and setting standards for psychiatry practice in Uganda. I hope you can hear me clearly. We are having an issue here at the Ministry of Health. Our networks are bad and not so good. And sometimes I may be like
Yes, we
crackling.
can.
My voices will be crackling. I have just a slide or two to share with you, and I hope I can do that. Let me try to see whether this is possible. If it is, yes. And I hope you can see my slides. My slide, I hope you can see it. I'll talk a lot through the slides, so just for guidance. Just let me, oh yeah, thank you, Racheal. Yes, I've seen that. Okay, so yes, the role, that was the thing I'm trying to answer. And it's quite loaded. There's quite a lot that I could speak through this, but for purposes of the 15 minutes, this is what I put out. The Ministry of Health in general, standards, policies, the regulatory framework on matters related to health, but in this particular space, those that are very specific for mental health. And the way we are organized as a ministry here, we are a division under the non-communicable diseases department. And yeah, it's just the two of us, myself and your very own, that is Dr. Kalani. I think your president, actually, president-elect, Dr. Kalani. We are the two of us, but we are working together with other people on contract, and those that are coming in just for, learning from different schools. So ideally, that is our role. So we participate in the development of laws, regulations, standards, policies, and guidelines that are related with mental health. So we're also responsible for building capacity, very specifically training and supporting healthcare workers, both pre and post-basic. And in this capacity building mandate, I think our role here is mainly for post-basic, because the pre-basic went into Ministry of Education. Although we sometimes participate as a ministry, I think you have included Dr. Kalan in many of the programs, and we are called once in a while in different universities to give a few modules of mental health to their students. The other issue is around resource mobilization. It is a mandate of the Ministry of Health to mobilize resources, and this can be human resource, it can be financial resource, can be in form of medicines, and all things, resources that could be needed for improving mental health services in the country. And of course, the allocation comes in. It is not a big mandate of the ministry. Yes, for the finances, we know that one is under the Ministry of Finance. But and even for the human resource, the allocation is under the Health Service Commission. But the deployment, yes, is done by the Ministry of Health. And when it comes to medicines, yes, the allocation of the different funds, I think that one is a function of the Ministry of Health generally. The other function that we have is coordination of service providers, mainly the private sector. There are quite a lot of players in there, and also researchers. Lately, we are getting quite a number of people who are interested in doing research around mental health, and many times they come in to us for their blessing and writing the support letters as it were. There's a lot of coordination work that also is happening, namely with civil society and government and non-government organizations that are coming in to do some work around mental health. And actually, this is a very tall order, because by the time we find out what people are doing, many times we are getting them on the wrong side. So yeah, it's a tall order, but it's our function, and just for reminding you. Then the other one is the support supervision. As a ministry, we're supposed to offer support supervision, technical, and emergency, and all that kind of supervision. And and we oversee service delivery in as far as mental health is concerned across the country. The most important function of the Ministry of Health is generally to provide that overall stewardship in mental health across the country. We are the ones who are advocating for improvements in mental health service delivery, in mental health, the way the picture, we shared the picture for mental health across the country, and I'm happy that is one thing that nature really brought out specifically. So what are some of these policies and regulations that are in place that are, controlling psychiatry practice? We have the Ministry of Health, or the Health Policy and Strategic Plan. These are two different documents. And out of those big documents, okay, maybe what I could just say, paraphrase that, in these documents, mental health is part of the minimum healthcare package. And they have provided that it should be provided in as part of, in an integrated manner at all levels of care. So with that, then we have the National Essential Healthcare Package, that one which mandates integration of mental health care services in general health care. And then the decentralization, we have that services were decentralized. So the regional referral hospitals at the level of the ministry, they are at the center level, the regional and national referral hospital, that is Costa Rica, at the national level, and then the lower facilities, these are for general hospitals, and lower down, that's the mandate of the of districts. But as a ministry, we oversee service delivery even at that level. So ideally, so this policy, that is what it says: integrated, decentralized, and has to happen at all levels of care. Then we have the Uganda Clinical Guidelines 2023. These are some of the policies that we've written here. And these ones under Chapter 9, there's a very big chapter on mental health. That was an achievement at that time. Initially, we were just part of some small thing somewhere. We would write a few things in there, but this time around, we managed to get a whole chapter. And so, that is guiding service delivery. We are following the international, the ICD-10, International Classification of Diseases Manual 10. So we've guided on how the medicines should be given. We provided for the different medicines at the different levels of care, depending on whether they are essential or they are vital or just necessary. So this is provided for those of you who do not own one. It is online. You can just download it, but you can also buy it from town. I think they have been printed. So Chapter 9 very specifically, it's the one that also mental health. Then we have our Bible, that is the Mental Health Act of 2019. This one streamlines service delivery, the modes of admission, the different kinds of admission methods, where people can come into care, assisted, voluntary, involuntary, all those are written out there. Then also the ways people can be discharged. Then also, we know that it's really paying a lot of attention to the quality of life and quality and human rights. It protects the human rights of people with mental illnesses. Then also guides on the special interventions. You know that there are very special interventions that have to be given by a psychiatrist only. We know that in the mental health world, there are quite a number of players, and we also insist that it should be multidisciplinary and so on. But there are certain mandates that were given to only the psychiatrists. So those of you who may not have the Mental Health Act, please look out for it. It is out there, very clear, and guides on these special interventions. And it is what else is it? The isolations, when someone has to be in isolation, they are discharged and so on. So these things are being clear and written out for only the psychiatrists. Then the other thing is the regulations, and I think this is the most important. We are writing out more regulations, and I hope that is what my colleague from the Uganda Medical Education Council is going to elaborate upon. These are guides we have written. We thought we'd write regulations, but according to the way the Mental Health Act is written, most of the things are very clear and spelled out. And the areas which needed to have regulations are those of around practice, like how to practice. But we are guided that you cannot regulate, you cannot tell someone who has gone through medicine and then have gone through another 3 years of expert training on mental health, and then you start prescribing to them what they should do. So they say that is not possible. but only that we can guide on how they can run their practice, like, private practice and so on. And when we reached at that point again, we found there was already a body, that is the Uganda Medical and Dental Practitioners Council, which is actually doing that role. However, when we reached out to them, they informed us that they did not have the guidelines on how to manage and supervise or even license the private mental health and rehabilitation centers. So that's where we came in. One of us really written out this document very well. We are now moving it to the different levels of care, but it's going to be moved by the Uganda Medical and Dental Practitioners Council. They have a joint council. So, they have a joint supervision guideline they're writing out. So we are going to input into that document. One thing that is coming out very clearly, but may require your attention, is the time required to supervise or own a private facility as psychiatrists. There was this submission. Someone was like, most of the newcomers have just stepped out of medical school. Many people just finish internship and then they get into studying psychiatry at master's level. So they're like, these people may not be able to supervise. We take a decision on very critical things if they've just come out of practice. So they were suggesting that can we give them either 2 or 3 years to have a bit of experience in managing mental health conditions before they can actually supervise other facilities that are, working on mental health. And remember, for the psychiatrists, we give them the most difficult cases, so it requires someone with a lot of experience to be able to think through and, relate and connect and, to be able to support the clinical officers or the people who are a little lower down there, or even the medical officers who may have mental health facilities within their clinics, to support them in offering quality care. So that is something, it was contentious, but it was like, but if someone has trained, then why would you, if someone has been trained and, and they have become experts, how would you give them extra time? But we found this was something that was being done in the other councils, the allied professionals, and even the nursing council. Before they give mandate for someone to own or even run a clinic or even support others, they required a bit of time to gain more experience, more than what others may have, more than what maybe the doctors or other people who may wish to consult them have. The other thing that this document, in the regulations, we have categorized the facilities depending on ownership. You'll find it there. There are some, there are clinics, the mental health clinics, there are the nursing homes. Of course, these ones are managed by the nurses. Then there are medical centers and then hospitals or specialistic facilities. So we've categorized these facilities depending on ownership, scope of work, and size. I'm assuming that my colleague is going to give the details, and that's what he's going to do, I hope. But in case he doesn't, I can still, give some more information about what is in these regulations in as far as licensing and inspection of the private facilities is concerned. We did not look into the public ones because for those that I think it's a given, like we just have the mental health units within the facilities, and these are managed as the hospital, as part of the hospital work. So that was the reason why we didn't get into there, and already systems are in place for that kind of care. And
Dr.
then,
Lukwata, allow me add you 2 minutes as we finalize.
okay, yes, and I'm finalizing. I just wanted to get to my next slide. And this is to the ask. When I get an opportunity to speak to you people, I have to give you this information. One, there's we have the report. I hope we have all listened to the report, the National Planning Authority report, giving the state of the population, and they put mental health as a key. They put mental health as a theme at mental health and emerging crisis, which truly it is. So for those of us in that field, we can see that it's really a crisis, that is a bubble that is about to burst. And my ask to you as professionals is to amplify the voice from mental health. Wherever there's mental health being mentioned, kindly come out, kindly be available. We have quite a number of radio programs, but we cannot be on all of them at the same time and all the time. So I'm calling upon you people when an opportunity calls, I'm sending the journalists to you, some of you, and I think you've heard them telling you that I've been sent by me. Please be part of the process, be part of the voice for mental health. The other thing that I wanted to call on you people is to support each other. When we are each running in our own small areas, we will not be strong. But if we put our hands together and make sure that we support each other and everyone works together, and very specifically for the freshers, the newcomers need a lot of our support because truly they are just new people. They've just come from school and they are not yet employed. So we need to have them on board. And then lastly, we need further research to guide in policy. So yeah, the policy is evolving, just like you rightly said. New things are coming up. We do not want to just fall into a sea of the panacea, where many things are being done at the same time, and then we are just rushing here and there. We can also have our own research here that will guide our policy. So I'm calling on all of you to be able to support us on this. I thank you very much for giving us this opportunity to speak to you, and we'll always be available to support you and there. So I submit for now and ready for any questions if there are any. I submit. Thank you.
Thank you very, very much, Dr. Lukwata, for summarizing, but also being very elaborative. I'm sure the members here have questions, but we'll take on those questions later. Allow me to introduce our second panelist, Dr. Ivan Kisuule, who is an internal medicine physician and a manager. He holds an MBCHB and an MMed from Makerere University and a postgraduate diploma in health service management and administration from the Uganda Management Institute. He's here in his capacity as the Deputy Registrar of the Uganda Medical and Dental Practitioners Council. Formerly, he worked at Mulago National Referral as a medical officer and as a physician, and he's a member of different associations, including the Uganda Medical Association. Dr. Kisuule, you're very welcome. Please do take us into the guidelines by the Uganda Medical and Dental Practitioners Council as we move towards providing better mental health care.
Yeah, thank you very much, Dr. Alinaitwe Racheal, for the kind introduction, and I'm happy to be here. I put on my video, I don't know if it's there, but yes, as introduced, I'm Dr. Kisuule Ivan. I'm happy to talk to the psychiatrists. When I got the invitation from Lillian, I said yes, I'll be able to make it. So I'm going to...
Dr. Kisuule, just a minute. I'm going to time you for the 15 minutes. I'll send a reminder at 5 minutes to your inbox.
Okay, thank you very much. And I want to appreciate the previous speaker, Dr. Hafsa Lukwata, if I got it right, for that perspective on the mandate of the Ministry of Health. The topic that was talk about is regulating and setting standards for psychiatric practice in Uganda. And those are my credentials. Just in the presentation outline, I know the time is very limited, so I tried to make a few slides. Briefly, I'll talk about the medical council and its mandate, and then I'll talk about updates on psychiatric practice in particular, and also the call to action to the Uganda Association of Psychiatrists. So just a brief introduction. The Medical Council is actually also under the Ministry of Health, but it is established by an Act of Parliament, which was enacted in 1998. It is currently Chapter 300 of the Constitution. But the council goes way back in 1933, which was borrowed from the General Medical Council of the UK. I've seen some colleagues from the UK attending this call. So the Medical Council is akin to the GMC of the UK, and it was actually derived from that. Currently, these acts of the professional councils are undergoing review to make the Health Professions Authority You may have heard about merger of government agencies. The council were exempted, but the ministry decided to form an authority to oversee the councils. But the other professional councils in Uganda, as we know, we have the Allied Health Professional Council, which regulates allied professionals, including the psychiatric clinical officers. So I will not talk about them. I wish I had also invited them. And then including the Uganda Nurses and Midwives Council, which regulates the psychiatric mental health nurses, and the Pharmacy Board, which regulates the pharmacists. Yeah, so the mandate of the council as far as regulation is concerned is mainly in 4 areas. 1, to monitor and supervise medical and data education standards in the training institutions, including continuing education. To register all eligible medical and dental practitioners in Uganda, including psychiatrists, to enforce acceptable standards of medical and dental practice, including psychiatry practice, and to investigate all reported cases of malpractice and take appropriate disciplinary action, including psychiatry malpractice. So I'm going to explain this a bit more, but paying particular attention to psychiatry practice, which is the key area of discussion this afternoon. So under supervision of medical and dental educational training in the schools, just an update that we currently have 14 medical schools in Uganda. 14 of them, 7 of them are public, 7 are private. And there are also 3 upcoming medical schools, Jeff International University, Avansi, and Indeji. They want to start MBCHB training. The dental schools are 4, and there's also an upcoming dental school. But significantly for psychiatry, M-Med, I've seen someone who is interested in M-Med. We have only 3 universities that train M-Med psychiatry: Makerere, Imbalala, and KIU. And you can see that there's still a huge gap in the training of psychiatrists in Uganda. And as I'm going to show you the number of psychiatrists, you are really very few, which actually compromises psychiatry practice in Uganda. So the point to note here is psychiatry training is only in 3 universities. And also, in regulation of medical training, we jointly inspect the medical and dental schools with the East African Community Medical and Dental Councils and the National Council for Higher Education. We regulate, so we do this in collaboration. We also review curricula for all medical, dental, and M-Med programs. We have just recently reviewed the M-Med psychiatry program from Makerere University. We operate fellowship training and subspecialty training. But to note, and this is also worrying, there's no local accredited subspecialty or fellowship training in psychiatry in Uganda. I was actually wondering if psychiatry has subspecialties because locally we don't have any subspecialty training, and some of you have had to go outside Uganda to subspecialize in psychiatry. So I think it's high time that psychiatry we get subspecialty training locally, because I believe that there are subspecialties in psychiatry. We also index medical and dental students and also M-Med students. So currently about, I think each of those universities is training about 10 psychiatrists per class. So that gives you the number that is likely to qualify in the coming years. So I'm trying to highlight the gaps in psychiatry practice, both in training and practice. The third mandate is to register all eligible medical and dental practitioners in Uganda. We all know that we have provisional registration for interns and full registration after internship. The foreign trained students do theory and clinical exams with the council, which we call the Medical Licensure Examination Board. And we want to initiate these exams even to the locally trained students, given the increasing number of graduates that we are getting, but where issues of quality are being raised by those in practice. I don't know if the psychiatrists have noted any issues with quality of the graduates, especially when it comes to psychiatry practice. I know that undergraduates do psychiatry for a very short time, so I wonder how much psychiatry they graduate with. And also to note, currently, as of today, our register has 10,850 registered practitioners, but the psychiatrists are only 71, which is 0.7% of doctors in Uganda. You can see how huge the gap is in psychiatry. I'm saying registered psychiatrists. I'm aware that there are some psychiatrists whom the council doesn't know. And I want to emphasize that you only become a psychiatrist when you are registered by the council. And then in enforcing acceptable standards of medical and dental practice, we issue annual practicing licenses. And currently, we have 5,658 doctors have renewed their license for 2026. Out of the 10,852 registered doctors, representing 52% compliance. Again, to note, of the 71 registered psychiatrists, only 40 of you, which is 56%, are licensed to practice this year, meaning that 31 of you have no license. We don't know whether they are in Uganda, whether they are abroad, whether they have died. We don't have that information. I think the association can help us to know whether they are around. And then we issue operating licenses for health units, including mental health units. Currently, there are 14 registered and licensed mental health units in Uganda. We know that there may be more, especially rehabilitation centers, addiction centers, which are not licensed by the council, meaning these ones are operating illegally. And we have started an operation to look for them. And when we found a facility that is not registered or licensed, if we find a psychiatrist working in such a facility, then that psychiatrist is answerable. And to mention that all rehabilitation centers, addiction centers, substance use disorder centers have to be registered and licensed by the council. And we also conduct inspection of mental health units and all health units in general. We have started, as I've said, we are on this year, we have set out to look out for all health units in Uganda, and we are paying particular attention to mental health units because of what is happening there. In the next presentation, maybe we shall update you on what we have found. We coordinate CPD activities like this one. I hope now UAP has got accreditation from UMDPC to offer CPD activities because we have accredited different associations to offer this continuous professional development. We educate the professionals and the public, like I'm educating you now. We're also supposed to go to radio talk shows and inform the public about what is happening in medical and dental practice. Now, the next topic, we also investigate all reported cases of malpractice and take appropriate disciplinary action. So when we talk of medical malpractice, we mean acts of omission or commission by a healthcare profession that deviates from accepted standards of care and causes injury to a patient. Good enough, we have not had any reported cases of malpractice among psychiatrists. Either you are not doing it or you are not being reported, which is something to applaud. But you are getting many cases from other disciplines. But I think psychiatry is not so much prone to malpractice. We also handle disciplinary cases of professional misconduct, medical negligence, and medical incompetence. And then the other area we handle, which is useful to psychiatry, is fitness to practice. We investigate doctors who have been found unfit to practice because of age, alcohol use disorder, this is the commonest, drug abuse. I remember you no longer call it alcohol abuse, you call it use disorder, DCM5, I think. Physical or mental illness. So we are having quite a number of doctors who are suffering from mental illness. And in my call to action, I really urge the UAP to help the council in helping these doctors to overcome substance use disorder and also mental illness, as I'll end up. Now, more updates which are relevant to UAP in regards to psychiatry practice. Currently, and as Dr. Hafsa alluded, we are developing guidelines for establishment and operation of private health units, including mental health units that are run by psychiatrists. We noted that there was a huge gap. Which mental health unit should be under a doctor? Which one should be under a psychotherapist? Which one should be under a psychiatric clinical officer? So we have written guidelines to this. I don't know whether we shall have time to consult the association, but some of you have participated in this. We have also prescribed that a mental health unit should be supervised by a psychiatrist. But we are worried that you are only 40 who are in active practice. So will you be able to supervise all the mental health units in Uganda? I think this is something we need to discuss, whether we should only allow a psychiatrist to supervise a mental health unit. And we have also said that one practitioner can supervise a maximum of 2 health units, meaning that one psychiatrist can supervise 2 mental health units. And that is effective this year. So you have an option to supervise 2 facilities as a psychiatrist. But you need to understand the rules of supervision. It's just not an issue of giving in your license, as we mostly say. It's not an issue of covering the facility. When you are supervising a health unit, you are responsible for the day-to-day clinical operations of that facility. And should anything go wrong in that facility, God forbid, you, the supervising doctor, you are answerable to the council. And you have seen doctors whose license has been cancelled, who have been suspended, those who have been taken to court. So you need to commit yourself to supervise when you know what you are committing to. We know some of you just give in your license, you don't even know where the facility is, you don't know what the people who are there, what they are doing to the patients, but you simply give your license to cover the facility, which is very wrong. And I hope that we take this up and really do proper supervision. We are also seeing that we get a number of practitioners who are affected by mental illness, and these are usually referred to psychiatrists for expert opinion to decide whether they should continue to practice or not. I'm sure there are senior colleagues in this meeting whom we have requested to give us opinion on the different mental health patients who are doctors that we have got. What really also surprises us that sometimes the opinion differs from one expert to another. One may say this one has schizophrenia, another colleague says it is bipolar, and then we are left in a gray area. Okay.
Dr. Kisuule, we have 2 more minutes.
Yeah, so my last slide, we have noted with concern the increasing number of practitioners affected by substance use disorder and other mental illnesses. So what is the call to action? As an association, there's something you can do, much as you have no legal mandate, but you can work with the council, you can advise the council. So you need to ensure that all qualified psychiatrists are registered and licensed by the council. In other words, no one should be a member of the association when they are not registered as a psychiatrist by the council. I need to hold continuous CPD sessions like this one and award CPD points to participants. I've already asked Lillian to submit an application for accreditation of the association. You need to share information with the council on issues concerning training and practice because the council is not able to reach everywhere. So you people who are in the field should inform the council of what is happening. And you need to advocate for good mental health for practitioners and the public. So that really, we don't only police those who have been caught, who have got to suffer from mental illness and addiction, but how can we help them not to get worse and also not to actually fall sick? And lastly, you need to participate in council activities whenever called upon. Yeah, I think in interest of time, I'll stop this here and wait for any questions and comments. I had a lot to share, but for today, let me stop there. Back to you, Racheal.
Thank you very much, Dr. Kisuule. These are very insightful discussions, and we are picking key lessons as an association, but also as practitioners in mental health. I will invite any questions. I can begin by reading some from the chat. People are requesting to have license renewals extended to 5 years or renewing for licenses for a longer time than just 1 year. I don't know what you would say about that, Dr. Kisuule, as the Deputy Registrar.
Should I answer one by one or you first list them?
I think the other one I can ask that goes to you is, does the Uganda Medical and Dental Practitioners Council have any psychiatrist on board? Yeah, I think you can respond to those 2, then we move to the next.
Yeah, thank you very much. Now, issues of renewing a license, it's called the annual practicing license, and this is according to the Act. So, so it has to be annual. Every year you have to be in good standing. You have to renew every year, okay? And if you miss any year, when you come back, you have to pay for all the years you have missed. So there's no saying that this year will not renew. So that is by law, so we can't change it now. And then any psychiatrist on the board. Now, the composition of the medical council, which is actually appointed by the minister, but selected from associations. The association which has representation on the council is the Uganda Medical Association. Yeah, but I'm happy to report that one of the newly qualified psychiatrists, Dr. Muyanga Mark, is a member of council, but is representing Uganda Medical Association, not Uganda Association of Psychiatrists. But I'm sure I can bring the views of UAP now that he's a bona fide member of the association. Yeah, so that's what I can say.
Thank you very much, Dr. Kisuule. I have more comments in the chat. Dr. Abel Vega, a psychiatrist, says private mental health units should strictly be supervised by psychiatrists to minimize abuse to patients. Let's not think of any alternative. So that's his comment. I'll read the next comment. Dr. Naku is requesting, are there guidelines at the medical council for assessing fitness to practice? Like you said, one person is going to say, in their opinion, it's schizophrenia. One person, it is bipolar. One person will say not fit to practice. Another will say fit to practice under supervision. Are there guidelines at the council? The next one, let me read the next three. Do psychiatrists in private practice need to serve only in hospital setting or medical clinics as well? That's number 2. Number 3, are there documented SOPs about the roles of supervising a mental health unit? I think these go to both Dr. Kisuule and Dr. Lukwata.
Okay, maybe if I may go first. Thank you very much for all these comments. I see someone saying that Avance is training in medicine. That one we are not aware, please. Please, if you know any...
Dr. Kisuule, are you still there? Are you people able to hear me? Is Dr.
Yes, Doctor,
Kisuule,
we are
yeah,
able.
you're right.
We are able to hear you,
Okay, so
but we cannot
I
hear
think
Dr. Kisuule.
Okay, I'll request Dr. Lukwata to come in as we wait for Dr. Kisuule to rejoin.
Okay. Okay, so thank you very much. There are some questions I didn't hear very clearly, but I will try to answer the ones I had. I think the role of the supervising unit, the question was around whether the psychiatrists should be the only ones to practice in private or to supervise private facilities. We also thought it was, but according to the allied and dental practice, the allied health professionals, they also have a provision. They've allowed their people to own clinics, and so the psychiatric clinical officers can own clinics. Those are the mental health clinics. But they were like, also they can do other work anyway when they are in those clinics. These psychiatric clinical officers can also do general medical care. So they also run in clinics, and they can own. The beauty about their side is that whereas on the medical and dental practitioners council, you do not have to own the facility. You can just supervise it. On the other side, the allies and the nurses, you have to be the owner. You cannot supervise any other person. You have to be the owner of the facility. So that's where the difference is. And they'll only give you if you have, I think they have a minimum time for gaining a bit of experience. I think for the allied, it is, I think 5. Is it 3 to 5 years? And then the ones of nursing is 10, is up to 10 years. So like you cannot own a clinic if you have not worked for 10 years. That is for the nurses. So yeah, that is what there is that side. So we cannot say no. We cannot put that if it is a request. But when it comes to supervising others, yes, I think you can only supervise, I mean, it's only psychiatrists who can supervise facilities that they don't own. I hope I'm clear that way. Then for the, I didn't get the other questions very well, but I liked that question about fitness to practice. And I think it can be divided into two. There's one for physical, but there's also through Butayika Hospital to give a mental assessment of the person. So having guidelines to that effect, I think would be good. And well, I think, yeah, it is high time we bring this to the attention of the council. And it's something we can do since we are in the process of developing guidelines around mental health. I didn't hear the other question. Over to you, Racheal.
I think the other question that relates to you, Dr. Lukwata, is are there documented SOPs about the roles of supervising?
No, there are no SOPs as yet, but we have developed guidelines. I don't know whether they won't fall in that docket. I don't know. When we have the guidelines, I don't know whether we shall have standard operating procedures. I think these ones are developed now by it could be you guys, you know, the professional bodies. You could set your own, you know, standard operating procedures. But I imagine these are very specific also for some interventions, like if you have to do an intervention X or Y, then you need to follow these steps. Like if you have to put someone into an isolation unit, then you have to follow these steps. I thought those would be the standard operating procedures, and this would be facility based and not necessarily have a national or whatever. But although we can have national ones, which can be copied or adapted by the local facilities, I think this is we have some room for discussion, but ideally, or on the other side, the physical side, that's how things happen. We have the guidelines, and then the facilities develop their own SOPs. But if it is necessary that we have SOPs, then that can also be possible. But also, I imagine the guidelines, the Uganda clinical guidelines, are providing the national view or the national agreed upon standards of how to treat. So those could also suffice as the standard operating procedures where they've been spelled out in the Uganda clinical guidelines. So unless there's a gap that we know or we have, then that's where we can come in and say, let's develop one for the whole country, as it were. I submit.
Thank you very much. I think there's an additional question before I move back to Dr. Kisuule and then finally to Edwin, whose hand is up. Dr. Lukwata, can psychiatrists also supervise those facilities that are owned by the PCOs? Or when they own, then they are autonomous?
Okay, so I think it depends on the level. We have provided for the different kind of work to be done at the different levels of care in the private settings. For instance, if someone is running a clinic, it has to be an outpatient. They have to offer a certain scope of work. I mean, they do certain things and not everything. And one of the things they need to do is to do follow-up of medication and also prescribe basic using first line only. You cannot give a second line treatment for someone. You cannot start it off. They can supervise or they can follow up the second line treatment if it's been provided by maybe a senior person or, you know, a psychiatrist for that matter. But they cannot start someone on second line treatment. You know, we've put that guideline somehow. So yeah, there are certain things that can be done by these primary facilities, I mean the clinics and the nursing units. We did not mandate them to have, actually we removed that section where we had initially mandated them to have someone to supervise them, but we said it was not going to be practical. So we removed that part and instead we reduced their scope of work. So like in the event that they need to do anything beyond their level of care, then they would get, you know, a support from a psychiatrist or someone above them. So that was the provision. That's what we wrote in there. Like it should be as and when, but we didn't want to make it a general thing. Like the psychiatrist has to supervise all the the mental health units in the country because it is not practical. You're not everywhere. And yeah, so we guided that way and we felt we're quite happy with what we had agreed on. I submit.
Okay, thank you very much, Dr. Lukwata. We are not everywhere, but our numbers are increasing very rapidly. Soon we should be able to scale up our work. Anyway, back to Dr. Kisuule. Thanks for being back. I'm going
Yes,
to highlight
Racheal.
a few comments from Dr. Naku, the ED of Butabika, which are in line with the Uganda Medical and Dental Practitioners Council. One, she's requesting, is there a process for getting a case to the council? Because it doesn't seem to be clear. The other concern she had raised when you went off was, are there guidelines on determining a fitness to practice? But then she also adds on another one, that cases have been submitted for impairment due to substance use disorder, and the council never takes action. Those are about 3 items in one. Over to you, Dr. Kisuule.
Thank you very much. Thank you, Dr. Naku, our senior teacher, for those comments and questions. I want to respond as follows. One, we have guidelines for fitness to practice. We actually have a fitness to practice committee. So the processes we follow, and getting an expert opinion is just one of the steps we undertake, but also the council looks at many other aspects before taking a decision on the doctor who has such a challenge. Now, how do we get complaints? There is a formal way of reporting a complaint to the council. One has to write a letter to the registrar. This letter may be hand-delivered at our office here in Mulago. It may be sent by email. Yeah, those are the acceptable options, not by WhatsApp or phone call. So it has to be written, and there has to be a complainant. That's what the law tells us. So once someone writes, we have a complaints form which they can fill in. And in fact, we have got some complaints I've now remembered from psychiatry cases. And then the psychiatrists in private practice need to serve only one facility? No. A psychiatrist, you are free to work in a clinic, in a medical center, or a hospital. You can operate an outpatient clinic. In fact, I think one of the things we are advocating for as a council, though we are not into welfare, that's for association, we are advising doctors to start up their own practice. Why should a psychiatrist be employed by a psychiatric clinical officer here? What does it take for you to set up a psychiatric outpatient clinic? All you need is a reception, a consultation room, maybe a treatment room, and a few other areas. And I'm happy that there is a group of psychiatrists that have come together to set up a private practice, and they encourage others to do the same. As we wait for government to recruit, let us get into private group practice. Because I believe really psychiatry, internal medicine, these are disciplines where we can easily start private practice without need for much capital. The capital is our brain. So the roles of a supervising doctor, whether in psychiatry or not, I've really disseminated this one so many times. The roles are the same. I'm going to share them again with Lillian, and you can share them with others. But I said in principle, the supervising doctor is running the facility, the day-to-day running of the facility, and is responsible. Yes, it is true the psychiatric clinical officers can also run private practice, but they are not allowed to admit. Any facility which admits a patient should be supervised by a doctor. And that is in the laws. So I think that should be clear. The psychiatric clinical officers can run outpatient clinics, but not admission facilities alone. SOPs for supervising mental health units. These ones, we have written them in the guidelines. We shall share them when they are ready. And lastly, supervising facilities owned by a PCO. Yes, a psychiatrist can supervise a facility owned by a PCO, but the question is, why should a psychiatrist do so? Can't you make your own, really? And lastly, there was a question on CPD points. Why UMA? When you read the Medical Council Act, it is UMA and UDA which are mentioned in the Act, and they have direct representation on the council. So that's why the council requested that doctors should have at least minimum 4 CPD points from those associations. But if the Association of Psychiatrists also expresses interest, it can be given a consideration. Yeah, I think this is what is a diploma nurse allowed to work on psychiatric patients? Yes, I'm a member of the Uganda Nurses and Midwives Council, and there is a cadre of nurses called mental health nurses. And they train at enroll certificate level and diploma level. I'm sure psychiatry, the School of Psychiatry in Butarika trains them. So those ones are allowed to work on psychiatry patients. Yeah, I think this is what I can answer for now.
Thank you very much, Dr.
I just
Ivan
wanted
Kisuule.
to add, a
Yeah.
little bit for the nurses. It's only the registered nurses who can run clinics. The ones that are enrolled have not been given the mandate to own, even run a clinic. Yeah. Yeah, but I also had a question, a little one. I'm sorry, I'm coming in for the fitness to practice guidelines. Is there a provision for mental health assessments for these people? And is there a mental health person really co-opted into this committee? If kindly, yes or no? Dr. Kisuule,
May I
over to you.
answer?
Dr.
Yeah,
Kisuule.
thank you. Yeah, thank you, Dr. Hasfa. Yeah, as I said, for the fitness to practice, we usually co-opt a psychiatrist where necessary, and we ask them for their expert opinion. I'm sure some psychiatrists on the call have participated in that. And where necessary, they come and sit in the committee when we are assessing the doctors. So they are co-opted when necessary. And then I wanted to answer again Dr. Juliet Naku. Dr. Juliet seems to have a lot of information which is necessary for the council. And that's what I ended with a call to action. Please give us information. If you're not the psychiatrist who did complete MMed, that's not a psychiatrist, that's the GP. And they can't be allowed to teach psychiatry. So please give us that information in confidence and we shall investigate further. So that's the call I made, that please, if you see something, let us know. My phone is open. That one, you may not even need to write. Just whistle blow and we shall investigate. Thank you.
Okay, thank you very much. Members, there's a link to the CPD points. Please check in the chat. Dr. Uma, I'm going to give you 30 seconds to summarize your question. Then we'll also take Robert's question. Edwin Uma.
Okay, thank you so much. I hope I'm clear. Thank you so much,
Loud
Kisuule,
and
the
clear.
moderator, and Dr. Lukwata. Am I clear?
Very
Okay.
clear. Proceed.
Thank you, Kisuule, Dr. Kisuule, for your comments. I'm happy if you say that for people to go and get or join an association like UPA, it would be great for them to first present their license. I think that's a great way of enforcing either way, or it could also be the other way. But my questions are pertaining to two things: policy and then patient safety. With regards to policy, at what point do associations get involved in policy development initiatives? Can they bring policy proposals? Is it to you, or it is straight to the Ministry of Health to change some of things or to improve on practices? And what is the normal, pathway to have them implemented? Then, in regards to patient safety, having a license is great. Having CPD points is great. You know that the guy is able to practice, but I think it is not enough, Dr. Kisuule. I don't know if you're reviewing your guidelines. It would probably be prudent, maybe, to discuss with these associations to develop KPIs, maybe for both facility and individual, so that you can probably upregulate facilities or downregulate facilities dependent on the KPIs and what kind of cases they are, managing, to avoid them creeping into other spaces to, make revenue. But also for individuals, it is important to have KPIs, because then they could probably show you whether this person is safe or is unsafe, even away just from a license. Thank you.
Thank you, Edwin. I think your questions are clear. Robert, please, in 10 seconds, give us your comments.
Yeah, thank you, moderator. Main is straight to Madam Hafsa and perhaps the association leadership. Main is directly to do with the recruitment of psychiatrists to district levels. As we are discussing regulating them in private practice, what is the stand of the ministry on the public health at district levels? Because these diploma holders you are giving permission to run these private facilities in districts, you find a whole district has no psychiatrist employed by government. most of the psychiatrists employed by Ministry of Health, you will find them at regional referrals, and even some regional referrals have been not having psychiatrists. Even those that have, they have been relying much on the universities which have medical schools attached to them. So I don't know, Madam Hafsa, what is the current stand of the ministry now that we have a good number of psychiatrists? Don't we need to send them down to district hospitals so that they can
Robert,
give supervision roles in those districts, and as well limit the referrals we receive to regional referrals? Thank you.
thank you very much. I'm going to give the panelists 2 minutes to answer those questions and we wrap up. Dr. Lukwata, let's begin from you. The last question.
Thank you
was
very
more-
much, Dr. Racheal. Very specific. I'm just going to answer as just a part of what he asked about policies and how they get into, how they get into the different levels and how they end up into practice. That's a whole topic of policy formulation and and translation of policies into actions. But what I can say is we just need to be very strategic. Policies are political. Politics, it has something to do with it has a political connotation. So it matters when you're making this policy, when you're writing, we need to have a window of opportunity like we are having now, colleagues. I'm calling upon you. We have a window of opportunity now to talk about mental health. Whoever has a policy, wherever they've written, any evidence, science, whatever, if you've done your research, this is our time. This is our window of opportunity. So the when is now. So the how is now what we need to really strategize on. We need to know where to put our things. There's a whole system in the Ministry of Health of the how do we call it, the working groups. There's the working groups, then they got into senior management, then you go to the health policy advocacy committee, then the top management. That the top management has the ministers and the commissioners, and that's where things can be done, and that's where the politics now comes in. And of course, there has to be a where, and I think the where is now there in Ministry of Health, maybe Parliament, whoever knows someone in President's office, and whatever. It can be anywhere. Colleagues, this is our time. Let us try to do something. I'm calling upon you. Let's do something. Then lastly, for the district issues, we have the Mental Health Act provides for mental health focal persons within the district. Every district should have a mental health focal person. And at that time, the spirit of that was to ensure that there's someone who oversees mental health services, and we're like, you can pick from anyone because there's no salary attached to it. So we're like, you can pick anyone from the regions or even the, how do we call them, the sub-districts, that is at the district level, the sub-districts. So if we can manage to push for the psychiatrists to be, if you can push like you're given position within the districts, that would be a great thing. But as a ministry, we are mainly putting them, the regulations have put them at the regional referral hospitals mainly, and theirs is to oversee even the 10 to 12 districts that are under this particular regional referral hospital. It's because of the numbers and of course the salary. We have a limit as to how much salary there is to every district. So that is what is still making it a problem. But we were promised that there will increase on funding for mental health. That was a promise that was made by the Minister of Finance. So we need to push and ensure, and this is the right time, this is the time we are budgeting. So we need to push and ensure that at least these people are there. Most of the districts, most of the health facilities are actually operating with the old human resource structure, but they're not getting onto the new one, which includes quite a number of psychiatrists and clinical psychologists. So thank you very much. I say bye to all of you, and I hope to see you again very soon. And this is our time. I'm saying this is our time, and I'm going to call on you to be on the radios, to be on whatever the media guys may want to listen to all of us. So kindly be available when you're needed. Thank you.
Thank you, Dr. Lukwata. We are very, very grateful that you could spare time to join us. I know you're running off for prayers.
Yeah, sure.
Over to you, Dr. Kisuule. Please, can we have your parting remarks?
Yeah, thank you very much. I'm also going for prayers, but the point is that I think this is just should be the starting of engagement. The council would like to work with the professional associations and most of the specialty associations to improve regulation and practice in the country. The challenge has been communication, but good enough now we have proactive leaders who have opened the communication channels. The council welcomes any suggestions, guidance, and any input to the regulation of practice, because we can't do this alone, much as we have the legal mandate, but we can't do it alone. So again, I'm emphasizing, give us information, give us queries, and then let us have more CPD sessions. Let us, have trainings where possible. The council may not have resources to share with the associations, but at least we can come in where possible. I see there are questions of decentralization, issues of deployment, recruitment and deployment. Dr. Swat has answered. That's a service commission. The role of the council stops at giving you a license to show that you are a registered and qualified practitioner. Employment is really not in our mandate, but we shall also continue to advocate for deployment. But also the question, which I also want the association to look at, do we have the people? If the ministry advertised for 20 psychiatrists today, shall it get them? Or can we advocate for more training of psychiatrists? I think this is a question I leave to the association to think about, because the ministry will tell you, or Health Service Commission, that sometimes they advertise and they don't get applicants. So I think we need to look at all aspects so that as we advocate for recruitment, we also advocate for more training. I thank you very much, and till next time.
Thank you very much, Dr. Kisuule. Yes, as we advocate for recruitment, we are surely advocating for more training, given that mental health has now become a silent, we are recognizing it as a silent epidemic. The few numbers we have need to be added on. So allow me to thank our esteemed panelists and all of you participants for this rich and thoughtful discussion. What remains important is that regulation is essential and it's going to require strong collaborations. And this is for us to continue refining the standards so that we are able to meet the realities of practice, the needs of the population in the evolving mental health care space. I want to assure all of us that as Uganda Association of Psychiatrists, we are ready to work hand in hand with the regulators and the policy partners to ensure that the profession grows in a structured, ethical, but also accountable way. On behalf of the association, I want to thank all of you for your contribution and your dedication to advancing mental health care in our country. I want to call upon all of us to carry this momentum forward and also to join us for our next CME, which will be on Friday, the 27th of March. We'll begin at 1 p.m. Today we had to begin earlier because of the prayers. I'm wishing all of you a mentally refreshing and fulfilling weekend. Let's go and serve the nation, but also take care of our own mental health. Enjoy your weekend.